This is the Emergency Medical Minute.
Okay, super quick today. Headache, common complaint. We see it a lot. I feel like there is probably a seasonal component to it. You feel like we haven't seen as many migraines last couple weeks as we typically do, and that's probably correct. A couple kind of wacky, interesting studies looking at correlation between environmental or meteorological factors for ED presentations for migraines. So one study looked at things like barometric pressure, phases of the moon, wind speed, temperature, humidity, and looked at frequency of visits for migraines. So this was a study with about 5,000 patients, and they found a correlation, unfortunately, not with things we would like to see like phases of the moon or barometric pressure, but there was a correlation with high temperatures and low humidity. There was definitely an increase in visits for headaches. With high humidity, there was actually definitely a decrease in visits with headache. Everything else was kind of a wash. Another study looked at some environmental factors. And this was actually a retrospective study that looked at 100,000 visits for headache retrospectively over a 10-year period. And it was patients who were ultimately diagnosed with either migraine or just plain headache as a diagnosis. And just looking at different factors, the only thing it found a real correlation was in days there was an increase in particulate matter, so actual increase in pollution in the air. There was a significant increase in people presenting with migraines or headaches. Not really a good take-home message for us, but just something. And, use a humidifier if you have headaches. All right.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.